In this video, I will talk about different mitochondrial disorders and their pattern of inheritance. So when a sperm and an egg combine, they would give rise to a zygote. Now, all the mitochondria of the egg are being transferred to the zygote, but none of the mitochondria from the sperm are being transferred. So therefore, if a male patient has a mitochondrial disorders, it wouldn't affect the progenies. But if a female patient has a mitochondrial disorders, then all the progenies will be affected. So as you can see, the pedigree that is shown here, the female has a disorder that is transmitted to all the progenies. The resultant male progeny, however, does not transmit the disease to any of the other progenies. Now here we have again another female progeny, and all the progenies are affected. And so here again another female progeny, and all the progenies are affected here. Now if these two males were to have other progenies, none of the progenies would be affected again. So again, keep in mind, since none of the mitochondria are coming from the sperm, males do not transmit any mitochondrial disorders. So examples of mitochondrial disorders include Leber hereditary optic neuropathy, or LHON, and in these patients they would develop painless loss of vision. The other condition is MELAS, which stands for mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. And finally, the final condition is myoclonic epilepsy with ragged red muscle fibers. And as the name implies, these patients present with generalized epilepsy, ataxia, and weakness. And one important feature of these patients is that once you obtain a muscle biopsy, you will see ragged red muscle fibers. And here is an example of ragged red muscle fibers that are shown here. And that concludes our discussion.